Hey, thank you so much for joining me on my platform. If you're new to this channel, please consider subscribing. On this platform, I share all nursing related experiences, thought-provoking topics, and just giving general encouragement and thought-provoking things to talk about and wonder about as a nurse. So stay tuned because in this video, I'm gonna talk about the 5 top cons of being a home care nurse. If you're considering being a home care nurse, please go back to my previous video on the top 5 pros of being a home care nurse because I don't want this to dissuade you. I'm just looking at it as a way of, hey, I know I can relate to some of the home care nurses out there and I want to learn how you deal with it. So without further ado, let's just go ahead and get started. The top reason for me in being a home care nurse is the boundaries for both the family and the nurse. When I say boundaries of the nurse, that means the nurse likes to call you outside of working hours, texting you about every little thing, questioning you about your nursing documentation, even so much as reading your nursing note and going back to the case manager and ratting you out. These are some of the cons that I have dealt with in terms of dealing with home care nursing. Other nurses have a very territorial position with their patient, especially if they have been there for a while. In terms of the boundaries of other nurses, one of the things I would warn you to do is to, for one, do not give your number to the other nurse under any circumstance. They do not need your phone number. If you need any assistance, then you will call the job for assistance or you will speak to the family for assistance. But there's no rhyme or reason for why that nurse should have your number. It's not called for. The second con is boundaries of the family. If the family has no boundaries and they think it's okay to call you after hours, text you after hours, ask you for favors, this is something that most agencies will warn you about on day one of the job. Sometimes family members, when they have a favorite nurse, because it will happen, they will have a favorite home care nurse, they will in a way compare you to that nurse. Sometimes you may have them say a comment as to, oh, well, this nurse does this, and this nurse does it this way, and this nurse does X, Y, and Z. And they're telling you these things because they're trying to compare you to the other nurse because they like what that nurse is doing and they may not like what you're doing. Or they may not, I don't know, they may not appreciate it. But I've run into that on occasion, and it may have been because this nurse had more experience than me and was able to come up with solutions to their problems that I wasn't able to. But at the same time, if that nurse was such a good nurse, she would have been sharing those tips with the family, and the family would in turn share them with me so that we could all comprehensively care for the patient on the same level and it not be this competition as to who's the better nurse. The third con for me personally, because I'm a newer nurse, is that it's slower in terms of learning new skills. When you're in a home care setting, you're dealing with patients that are much more stable than those that have been admitted to a hospital or a nursing home or a long-term care facility. You're dealing with patients that have a pretty fair prognosis, so they don't have a lot of changes in their plan of care. So if you're like me and you like to see and touch and be around every little thing and every new thing because you're so goo-goo and gaga-eyed, you want to learn everything, especially as a new nurse, then you may get a little flustered and you may even get a little bored because you just want more of a challenge. So that's the only part that for new nurses that want to learn everything more and faster, that's probably the downside of being a home care nurse. The fourth reason is the micromanaging family. This is basically where a family member or even the entire family will want to micromanage everything that you do. If you don't do things exactly how they showed you on day one, you are labeled as incompetent in their eyes, and they need to hover over you on everything that you do to ensure that you are doing it right. I have run into this one or two times, and I can tell you from experience that I don't like it, and I never last in those homes because I don't like to be hovered over. I don't like to be micromanaged, and I'm professional enough to know when to ask questions if I need help. But I don't like being told exactly how to do my job. Let me do my job, and as long as I'm getting the same result, it should not matter how I do it as long as I get the final result. And the last situation, the last con is dealing with those awkward family moments where the family or the husband or wife or the child is being yelled at, and you're just kind of there like, yeah, I'm gonna go over here and do. It's just so awkward. You'll have those awkward moments where you are caught in the middle of the husband and the wife arguing, or the wife is telling you about how trash her husband is. And the only way to handle that is to kind of sit there and nod and, just, okay, I'm sorry to hear that. Don't give your opinion if you're asked. Just say, I don't know. That's the safest thing you can say is, I don't know, or I can't tell, or just play stupid, because you get caught up in it. It's gonna happen. If you've been in the home long enough, you're gonna see it. It's gonna happen. Learn how to ignore things, learn how to play dumb, and learn how to pretend like you don't even know what's going on. That has saved me immensely, and I'm still standing as a home care nurse. Mind you, I'm a new nurse, so. But anyway, let me know what you think. Can you relate to any of these? What are your crazy situations, or what are your cons of being a home care nurse? Let me hear from you in the comments below. Thanks for watching.